Again, I'm Getty Chimeka Nyawoke, chair of the AMPA COVID-19 Task Force, as well as chair of the AMPA Infectious Disease Committee. And we're here today to talk about COVID-19 update as Delta variant spreads. So I defined previously, what is a mutation? A mutation is a change in the virus genetic sequence. They're extremely common. We've had more than 4,000 recorded mutations so far in the coronavirus spike protein alone. Mutations usually arise when viruses make shoddy copies, like, you know, if you are in a factory and you're manufacturing stuff, some of them will come out not right. And so when they make those shoddy copies of themselves inside a patient, they become a mutation. And a variant on its own is a virus whose genetic sequence differs from that of its parent. And what's a strain? A strain is a variant with many mutations that significantly affects its behavior. So I gave this as an example, the E484K mutation. This mutation is found in the South African variant. The South African variant, mind you, has been around since May of 2020. And then it's also found in the Brazilian variant, which I think was around by November of 2020. And then there was one of the New York variants contained the E484K mutation. This mutation is known to weaken antibody response to the virus. So I gave an example. The mutation that's affected, the part of the protein that's affected. So when you send an RNA protein, is a messenger RNA, you say, go produce this protein. You give it its code. It goes over there. It's supposed to produce the protein as GG, UG, UU, G, AA, GG, UU. And that's what's going to be for that particular part of the protein. Well, it got there during replication and it produced GG, UG, UU. Instead of G, it switched to A. And then it produced AA, GG, UU. Effectively, it has changed the parent strain to something slightly different. That's what you call a variant. And that new variant becomes a strain as a result of the fact that the RNA has changed and the behavior has changed. So this is the parent strain. This is the RNA in here, the DNA. The RNA, because it's an RNA virus. This is the spike protein that gives it its name corona, because this looks like a crown. And so in producing this RNA, in producing this RNA that's going to produce a protein here, there is that mutation that I just showed you occurred. Once that mutation occurs, this new strain has effectively become a variant because of the change in the RNA. Now that change in the RNA causes a change in the viral behavior. So this is a brand new strain from the parent strain. I think that's where we got to before I got to this. So the threat levels, there are 3 of them. The variant of interest is when you get this new strain that you're noticing is behaving a little different. So you'll be like, this variant, I think is interesting. Let me watch and see what it does. And then when it starts causing problems, like we have the Delta variant now, you list that it caused enough problems to say this is a variant of concern. And then there's variant of high consequence, when the variant becomes so consequential. Slight projection here where you have variants of concern and variants of interest. So if we remember the one we call the UK variant, that's the B117, has been recently renamed by the WHO as Alpha variant. And then the variant that was the South African variant was known as the B1351. Now it's known as the Beta variant. The one from Brazil was just the P1, is now known as the Gamma variant. And this strain, B16172 from India, was first noticed in October of 2020. They became prominent in India earlier this year, maybe in March. Is known as the Delta variant. And the Delta variant actually has a Delta plus variant that has been found in India about 3 or 4 months ago. Now, let's come to the variants of interest. We have the Epsilon variant, the variant that was found in California. And then there's the P2 that was found in Brazil. It's called the Zeta. The New York variant B1525 is called Eta. The one that was found in Philippines, P3, is called Theta. The other one that was found in New York, which was B1526, was Iota. And the other variant in India right now, B16171, is called Kappa. So these new names for COVID-19 variants of concern, again, the alpha is the one that's B117, beta is B1351, gamma P1, delta is B16172. So let's talk about delta variant. This slide is a little blurry, but it shows you where the delta variant is gaining ground. This is a little backward. This slide is about at least a month or almost 2 months old. Right now, I think the US has overtaken the UK. And there are other areas of the world. It's been identified in 126 countries as at this time. And so these are the global variants report. These blue areas are where you have verification of variants that have been reported. These other areas that are slightly blue are the unverified variants reported. And then there are some areas where the variants haven't been reported. And again, this is slightly old. This is about almost a month old. So should I be concerned about the Delta variant? The new data show Delta is different than past versions of the virus. It seems to be much more contagious. Vaccinated people can get breakthrough infections of Delta variant and may be contagious. Vaccinated individuals represent a very small amount of total transmission. So majority of the transmission still comes from unvaccinated people. So getting vaccinated, this now is from the CDC, and I'm just bringing this message. Getting vaccinated prevents severe illness, prevents hospitalization and death. It also helps to reduce the spread of the virus in communities. Unvaccinated individuals should get vaccinated and continue masking until they are fully vaccinated. With the Delta variant, this is more urgent than ever for people to get vaccinated. The highest spread of cases and severe outcomes is happening in places with low vaccination rates. I mean, we're seeing it in the news every day. Data is showing that Delta is different than past versions of the virus. It is much more contagious. I talked about virtually all hospitalizations and deaths continue to be among the vaccinated, amongst the unvaccinated. In areas with substantial and high transmission, the CDC reversed itself on July 27th and recommends now that everyone, including fully vaccinated individuals, wear a mask in public indoor settings to help prevent spread of Delta and protect others. This is an area that they have substantial and high transmissibility. And those are areas that have not been, that have been majorly or mainly, you have more people unvaccinated in those areas. They are, I think about 50% of the US population in all different areas of the US have less than 40% of the people vaccinated. So you can see why this would be a concern. CDC recommends that community leaders encourage vaccination and masking to prevent further outbreaks in areas of substantial and high transmission. CDC also recommends universal indoor masking for all teachers, staff, students, and visitors to K-12 schools, regardless of their vaccination status. Children should return to full-time in-person learning in the as long as they follow these measures. So vaccination is the most important public health action to end the COVID-19 pandemic. I don't think that we can overemphasize this. We should be saying this and saying this and saying this and shouting it from the rooftop. If we get vaccinated, we prevent severe illness. We prevent hospitalizations and death. We need more people vaccinated. Vaccination coverage by county in the US ranges from 9% to 89% in some areas, and it remains below 40% in over half of the counties, like I said earlier on. Areas of low vaccination coverage have rapidly increasing cases. I am in Louisiana, I'm in the suburb of Baton Rouge. If I tell you how many COVID patients I have seen in the last 3 weeks, It's simply unbelievable. I am beginning to imagine like they go somewhere and somebody is putting the COVID in the air, like some powder, and just everybody is getting it. And this time around, it's mainly young people getting the COVID. I mean, it's unbelievable what's happening. It's like somebody just sprinkled the COVID in the air and it's just catching like wildfire. So COVID-19 cases have increased over 300% nationally from June 19th to July 23rd. 2021. This is driven by the highly transmissible B.1.617.2, which is the Delta variant. Importantly, while we are seeing case numbers similar to the wave we experienced, like the wave that we experienced last summer, there are over 70% fewer deaths, due largely to the impact of the vaccines. Healthcare systems are being strained in many states with surging cases, imperiling providers' ability to deliver care, not only for patients with COVID-19, but also those with other healthcare needs. We are in a race against time to increase vaccination coverage before new variants emerge. And that's really what really bothers me. You saw how we show how the variants occur. As long as this virus keeps having human beings to infect, it will keep replicating. And what we're going to have is probably more or worse of what we're having right now. We continue to have good evidence that the vaccines are safe and effective, and they provide protection against the variants circulating in the United States. Data also demonstrate that the vaccines are preventing severe illness, they are preventing hospitalization, and they are preventing deaths. They are very effective against the Delta variant. Vaccination is the best way to protect you, your family, my family, and our community. High vaccination coverage will reduce spread of the virus and help prevent new variants from emerging. So we continue to have good evidence that these vaccines are safe. And like I said before, they prevent hospitalization, severe illness, and death. So for us to stop the spread of the virus and prevent strong new variants, what should we do? We should continue the same measures that we were using before to mitigate. Getting the vaccine, in addition to getting the vaccine right now that is available here in the US, washing our hands frequently, keeping at least 6 feet distance, and wearing our mask. In the places where we do not have easy access to wash our hands with water and soap, we can use hand sanitizer. We can also talk to our neighbors. We can talk to our family members. And those of us that are physicians or healthcare practitioners should talk to our patients and people we come across and explain why we have to do what we have to do. We are in this together. If we feel that because, you know, my area is vaccinated, I don't have to worry about this, that's not possible, because if it's propagating, you may have newer strains that might become even stronger and more virulent and may even overpower the vaccines. This is why it's in the interest of all of us to get vaccinated and to prevent COVID infection. A lot of my numbers and data came from the CDC. I thank you all for listening. I am very open to questions. Thank you. And I thank Dr. Dosomu Ogumbi for allowing me, giving me the opportunity to come in here and present. Thank you. I'm going to stop sharing for now.